thought I would talk a little bit about vaccination in children, because there's been a lot in the press and some parents are understandably concerned. So as everybody knows, vaccination is now being given to children over 12, to all children. And that's recommended by the Royal College of Paediatrics in Children and Child's Health, and also recommended by the British Congenital Cardiac Association. So the concerns have been raised about myocarditis in children following COVID vaccination. So myocarditis is inflammation of the heart muscle, and it is certainly a serious condition. And it has been noticed after the COVID vaccination. So the incidence of myocarditis following COVID vaccination in children is of the order of 1 in 16,700. That needs to be compared with the incidence of developing myocarditis after getting COVID illness as a child. So if you catch COVID illness as a child, your risk of getting myocarditis is approximately 5 times higher than your risk of getting myocarditis if you receive the vaccination. In addition, if you catch COVID as a child, we know that there are some children who get long COVID. We know that there are some children who get this, unfortunately, inflammatory condition we call PIMS, which can lead to coronary artery aneurysms and can lead to, again, problems with heart function and becoming very seriously unwell. And also, as we know, if you catch COVID, you might miss quite a lot of school. So that's the reason that we are recommending COVID vaccination in children. We know that there are no children who have died following COVID vaccination, but sadly there are children who have died of COVID. It's not common, but it has happened. So also, the other thing to say is that the risk of myocarditis following the COVID vaccination, it tends to be more in boys, and it tends to be more after the second vaccination. So that is the rationale of us deciding only to give one vaccine to children. But overall, with the evidence that we have that nobody's died of the COVID vaccine, the risk of myocarditis is much higher if you get COVID rather than with the vaccine. We are recommending vaccination. Children who have complex congenital heart disease, we're actually recommending 2 doses of vaccination. So some people are thinking, oh, well, my child's already got heart problems, so it's probably safer they don't take the COVID vaccine. But in fact, we're saying the converse. There aren't any guidelines for children with Marfan syndrome, how many we should give. My personal preference for my patients is to say have 1. And once you've had 1, we'll have more evidence in a number of months, because we'll have many, many thousands of children who will be vaccinated, and then we can decide whether to give 2. The British Congenital Cardiac Association have said we should give 2 to children whose hearts are working really hard, who are already on significant amounts of cardiac medication, and who already have cardiomyopathy, which really isn't the case for our Marfan children. So my advice overall would be, if you have a child with Marfan, I would definitely go for at least 1 vaccination. And if you're really worried, you could ask your specialist if they would consider asking if you could have 2 vaccines, but at least 1 would be my recommendation. I hope that's helpful, everyone.
Thank you, Nitha. Nitha is Dr. Nitha Naqvi, consultant pediatric cardiologist at the Brompton, who runs the Marfan clinic there, and has recently agreed to be one of our trustees for the Marfan Trust.